Good morning, everybody. Will Dupree here in the KXAN Live studio. We are about to bring you a briefing that's about to start from the University of Texas at Austin. It has been named by the state of Texas as a COVID-19 distribution site for a vaccine that's going to be coming. A few officials are going to be speaking here in just a moment from UT and its health services program. So let's listen in as this briefing gets underway now from UT.
And we did receive some questions from our community, which I'll pop up in the chat area. And beyond that, please, for the journalists and others on the call who have questions, don't be shy. Please get those coming to us right away so that we can keep the conversation going. And if you have non-COVID questions or anything we can't answer, we will follow up with you after the call. So with that, let me hand it to Jonathan Robb, who's the Director of Emergency Preparedness here at the university, and he can give you a very brief overview from the logistics side of what we're doing with the vaccine. Jonathan?
Thank you, JB. Good morning, everyone. Thank you all for joining us. I just wanted to start off and say how excited we are here at the university to be a part of this operation. You know, we're in unprecedented times right now, and being able to collaborate both with our federal, state, and local partners is a great opportunity for us, and we're really excited to be a part of it.
Great. And I have some questions from the community here. The first one is, will vaccines at UT Austin be mandatory? Oh, Amy, you're on mute there, I think.
I can take that. So at this point, vaccination is voluntary. We hope that as many people that are willing and able will be vaccinated. It's just a very important layer in our ongoing fight against COVID. So, you know, we know while you get the vaccine, you have more protection, and as more people get vaccinated, we'll have more protection for our community. But it's really important to all of us to remember to mask and social distance and wash our hands as we go through this period.
Thank you. Another question we've received is, how many people will need to get vaccinated to reach herd immunity?
We've seen some different numbers on that goal. So right now, our real focus is to get as many members of our community vaccinated as possible to complete the two-shot series. And even once they get vaccinated, it's critically important that we all continue to do the social distancing, the masks, until we get to that level of immunity within our community for it to be effective. You know, we're not out of the woods yet, but we want to encourage folks to participate, to get the vaccine, and continue to follow the remainder of the social distancing and mask guidance.
Thank you. And then how will UT ensure equitable vaccine distribution?
So JB, I can take that one. You know, one of the things that we hope is that, you know, all of our students, staff, and faculty will get vaccinated through this process. But in order to make sure that we equitably distribute vaccine and get vaccine to people that are at most risk or important to, you know, maintain, you know, the functions of our society, it's important that we follow the guidelines that we have. And so we've received guidelines from the CDC and guidelines from the state. Those continually are updated, and so we're following those closely to make sure that we stay, you know, in compliance and in lockstep with those agencies as we go forward with our vaccination process on campus.
Thank you. And then when can general staff get the vaccine? I think that's a reference to people beyond the first groups that will receive it. Jonathan, is that one you can take?
Oh, we're still unsure. We're still waiting for those final guidelines coming from both the federal and state level, so we'll be monitoring those closely and communicate that out when that comes available. But likely that'll be once all healthcare workers are vaccinated, they'll move on to those other populations.
Thanks. And then from Melissa Gord at KXAN, what percentage of the campus community are you aiming to get vaccinated?
We'd love to get as many people vaccinated as possible. And we certainly respect that this is a personal decision and one that many people that everyone is very concerned about, and we would encourage people to make that informed decision for themselves. But our hope is that as many eligible people get the vaccine as possible.
Thanks. And then from Bridget Spencer, is it true that due to COVID, the Longhorn football team has paused activities? Will the vaccine be going to athletes as well? So Bridget, we'll have to follow up with the specifics on the football team announcement after the call, because I don't have anyone from we don't have anyone from athletics here on the call. So we'll get you the specific answers through athletics after this call. Will the vaccine go into athletes? Athletes are students, so anybody want to take that one? But
I'm happy to take that. So, at least based on the tiers that we've seen so far, students appear or have appeared in different tiers as we've been going through in order of vaccines. And so when we get through this first tranche of what are healthcare providers, and we see what the latest recommendations are from the CDC and the state for students, they would fall into that category.
Great, thank you. And then a question from Alyssa at KXAN for Dr. Hines. A few weeks ago, you expressed concern about the risk of spread from other places to Austin at the start of the spring semester when students return from their home communities to Austin and to the dorms. What risk do you believe there is of increased spread when some campus operations resume in the spring and some community members return to campus?
That's certainly a concern, and it was one we had in the fall. It's one that we had after Thanksgiving, and it will be certainly the case again in the spring. And we have communicated to our community in ways to try to mitigate that risk, to limit social interactions in the 7 days prior to returning to campus, to get tested through our proactive community testing program after arrival back in Austin, and to continue that limiting of social interactions going in the following few days. So we'll continue to push education and the guidance from the CDC with respect to travel, but it's certainly something we're thinking about, we're talking to our community about, and hoping that we can give them the best advice possible in terms of reducing that risk.
Thanks. And Terrence and Amy, I think I've heard both of you speak about how that was something we learned from the fall semester. Is that true? In terms of doing more, some of this isolation and quarantining around the return to campus?
Yeah, I think, JB, we learned a lot over the course of this past semester. We've had the ability to look at our own epidemiologic curves, when the kids first came back to school. And in doing that, we've made some recommendations specifically around that quarantine period and the need for testing in that space. I mean, overall, when we look at the semester, it seems like that the faculty, staff, and students have really adopted the behaviors that we've recommended, and we've been able to continue to offer in-person classes until, recently as planned for the Thanksgiving break. So I think that learning from that and following the recommendations that Terrence has outlined, we should be in good stead based on the previous experiences.
Thank you. Okay, from Kate McGee at the Texas Tribune. Could UT mandate a COVID vaccine like colleges do for meningitis? Why keep it voluntary at this point? Who can take that one?
With respect to meningitis, it's mandated through state law. But as far as the COVID vaccine goes, I think it's just important to highlight the vaccine is really only one step, one layer in the ways that we hope to protect our campus. It's also a new vaccine, and we're continuing to learn about that. So we're also respectful that this is a personal choice for a lot of folks who take it very seriously.
And we can get you some additional information on that, Kate, after the call as well, because I understand this question relates to the authority that's delegated to different organizations around the state. All right, from on Uraga, Justin, how many initial doses will the university receive? And all of them will go to healthcare workers, correct, in the initial round? Jonathan, is that for you?
So we have under 3,000 doses that will come to us. Yes, all of them will be going based off the state and federal guidelines. All of them will be going towards healthcare workers.
Thank you. And the exact numbers up on the COVID-19 dashboard, I understand. All right, from Melissa, again, to clarify, will UT Austin be administering vaccines only for students and employees, or will UT Austin play a role in administering vaccines for the broader Austin community? Amy, I think this one's for you.
Sure. So at this point, we'll be starting out working with our healthcare providers according to the state regulations and guidelines around the immunization of healthcare providers. But because we have a nursing school that has outpatient clinics and UT Health Austin has outpatient clinics, we contemplate when we get to some of those later stages of vaccine administration that we would be offering and administering vaccines to the greater Austin community.
Thanks. And then how are students who have patient interactions, nursing school, medical school, how are they incorporated into vaccine distribution plans? Is that for you, Jonathan?
Yeah, I can take that. So depending on what their job functions are as part of their criteria, they will fall under the state and federal guideline definition. So we're including them. If they meet the criteria early on as part of our healthcare workers, they'll be included there, or later on in the process, depending on what their qualifications are and what their job functions are with those respected areas.
Thanks. And another one for you, Jonathan, from Melissa Gord. Is the Pfizer vaccine the first one you expect to receive? How will it be transported, stored, and kept cold?
As of right now, depending on the approval with the emergency use authorization, yes, the Pfizer is the first one that is up for that approval. Moderna following close behind that. So likely it will be the Pfizer one that would be received first. The transportation storage, it needs to be kept at negative 80 degrees, so ultra cold storage. We have identified locations across our campus to store those vaccines, and then it'll be transported according to our plans to our dispensing sites.
Thank you. Community question, what does it cost to get the vaccine?
The CDC has said vaccines will be provided at no cost to the individual.
Thank you. From Bridget Spencer, do healthcare workers have a choice in taking the vaccine, or is it mandated for them?
I can take this one, JB. So healthcare providers do have a choice. It would be considered voluntary for our healthcare providers as well. We are recommending this for all healthcare providers, as this is a place of significant exposure, but it is still voluntary.
Thank you. From Kate McGee, once healthcare workers are covered, who comes next? Will it be first come, first serve, or will UT prioritize certain groups within campus? Or is that mandated by state and feds also? Jonathan?
Yes, it is mandated by state and federal levels, so we'll wait for those guidance for the next phases, and then we will prioritize those groups based off those definitions.
All right. If there are any additional questions, let me know. If not, I'm going to wrap up here in just a minute. So I'll give you guys just a second to see if there's anything else coming in. And if not, thank you very much for taking the, that's it. Thank you very much for, I have one more, okay. Will there be an administrative fee to get the shot? From Betty Cross.
So my understanding, JB, is that there is not an administrative fee to the individual, but that their insurer would be billed the administration code. That's what my understanding is today. We're continuing to learn as we go through this.
And then will distributing the vaccine to the community cost UT Austin anything?
We're still evaluating any costs that will incur as we distribute it, but as of right now, we're still in those planning processes.
All right. Well, thank you very much for these questions. Oh, I got one more. I'm gonna take it and then take this as our last question. What day do you expect to get the vaccines? Jonathan, that's for you.
It's still undetermined at this time. We're still waiting on that approval from both the FDA and the CDC. So as of right now, we can't give a definitive answer of when we'll get those.
Well, thanks for these questions. We know there'll be a lot of questions in the weeks and months to come. In addition to our own distribution leaders here that you're speaking with, we have subject matter experts on vaccines in our scientific community. So we look forward to sharing a lot more information about how we distribute the vaccines and what we're learning about it on the scientific and research level. So we'll continue this conversation as we move forward. And follow up, please bring your additional questions, send them to us in media relations or Susan Hokeman or Melissa Lowe in communications, and we'll get you follow-up answers later today. And with that, I'd just like to throw it to Dr. Hines for the end here.
Yeah, thanks, JB. I think like Jonathan mentioned earlier, we're really excited about this opportunity to take the next step in protecting our UT Austin community. We have faith in the vaccine and the science behind it, in its safety and its effectiveness, and looking forward to getting the vaccine myself, as well as us working together to help protect our UT Austin and surrounding communities.
Thank you. Thanks to our participants and everyone who joined us. And see you at the next Zoom briefing.
All right, everybody. Will Dupree once again here in the KXAN Live studio. We've just wrapped up that virtual briefing held by the University of Texas at Austin. You heard from Dr. Amy Young, who is the Vice Dean of Professional Practice at the Dell Medical School and the Chief Clinical Officer at UT Health Austin. Jonathan Robb, who is the Director of the Office of Campus Safety at UT Austin, and Dr. Terrence Hines, the Executive Director and Chief Medical Officer at University Health Services. What they were discussing in particular is that the state has designated the University of Texas at Austin as a distribution site for the COVID-19 vaccine once it's available and sent out. So that is some interesting news that they wanted to talk about and discuss a little bit about their particular plan for getting it out there. What they did say is that they are unsure of what date they will be getting those initial vaccines for the coronavirus. However, are expected to receive about 3,000 doses in that initial shipment, and those will go strictly to healthcare workers first. And again, they are still nailing down plans and waiting guidance from the state and federal government, particularly from the CDC, to figure out who will get it after those healthcare workers receive their shots for the novel coronavirus. So, of course, we'll be still covering that too. And interesting to point out that Dr. Hines, the director for University Health Services, said that he is looking forward to getting the vaccine himself. And he said, quote, "We have faith in the vaccine. Again, we are awaiting official emergency usage authorizations from the FDA, the Food and Drug Administration, for the Pfizer vaccine and the Moderna vaccine. And those are expected potentially later this week or even next week. So we will, of course, keep following that. Our reporter, Alyssa Gord, was listening into that briefing. You may have heard that J.B. Bird, the chief spokesperson for UT Austin, was mentioning her name. She's going to be writing up a web article about this and turning a story for it in our later newscast this evening, so you can look out for that. As always, more information is available on our website, kxan.com, and on the KXAN News app, so please download that if you've not done so already. Thanks again, everybody, for watching our stream. I'm Will Dupree here in the KXAN Live studio. We'll see you back here another time. Please, everyone, stay safe and stay healthy.